This exercise is about cochlear implant insertion. This assumes that you have already done a posterior tympanotomy and the round window niche should be visible. A small 0.8 millimeter burr is taken and the superior lip of the round window membrane is drilled. Once the round window membrane is seen clearly, then the anterior lip is drilled and then the posterior lip. It is generally not necessary to drill the inferior lip because it is generally flush with the round inner membrane. The round inner membrane is now seen clearly and then it is opened with a small pick, which is now shown. The membrane can be generally be lifted away from the basal turn. The implant is held using an implant insertion forceps and should be straight. It should be taken and gently inserted into the membrane without any bend. A good cochlear implant surgeon would ensure that the implant goes in one line along the curve of the basal turn. If the electrode bends, it is pertinent to use an instrument to steady the electrode. Each electrode is inserted millimeter by millimeter carefully and gently into the round window. You can see a pick being used to steady the implant so that it doesn't kink. Utmost care must be used to insert. It should be slow to prevent damage and it should be careful to prevent any kinking of the electrode. Complete insertion is achieved when the ring or the marker is in line with the round window membrane. The electrode is then fixed onto the mastoid cavity. This is the technique of cochlear implant insertion in a temporal bone. It is difficult, but it is important that it be practiced before an actual cochlear implant surgery is done.